are we making progress? So let's hope so. Let's hope we've nearly finished. Are we making it in diagnostic imaging? Are we making it in our interpretation? And are we making it in treatments? Diagnostic imaging, obviously, definitely. This is now becoming, all of these modalities are filtering down to our use in equine imaging. Just as from an MRI perspective, these magnets are now dotted around the country. I hope this is up to date. I'm not sure if it is completely, but they're now dotted around the country. Most people have now got access to an MRI machine. And what's that done to the scan numbers? Well, just exponential, really. We're scanning more and more horses yearly, and it seems to be increasing quite consistently as well. So there's no shortage of horses that are having an MRI scan. Pathology, I haven't touched on. I've stuck to the foot today, and I do a lot of talks about fetlocks and other areas as well. But we are certainly now appreciating a whole range of pathologies which we perhaps knew existed but didn't understand the nuances of them, and how horses can carry certain types of pathology and how they appear to us clinically versus what's actually going on in the foot. So we're finding a spectrum of disease of the navicular area. The coffin joint cartilage is a very interesting area which will become more interesting, I'm sure. The ligaments of the foot, as I've said, are now thought to be much more relevant than they once were. Fetlock disease, my pet subject, it's just revolutionised how we detect these types of injuries in the racing thoroughbred, and stress injuries of the proximal metacarpus as well, and obviously not just race horses there, but competition horses as well. Treatments, I cannot tell you how you will now reinvigorate your farriers to do a better job. It's a tricky thing. Obviously the farrier is incredibly important to these horses. They remain incredibly important to these horses despite the fact that we'll inject £1,000 worth of IRAP into them afterwards. Horses with problems deep within the feet are more sensitive to needing corrective farriery. So this is a horse that came in not that long ago for MRI. So these underrunning heels, doesn't need to have a corn for that to be having an impact on that horse's foot health. So working closely with your farrier is still very important, and they will actually do you a good job in referring horses for MRI as well. So they'll often suggest to owners that perhaps an MRI scan is indicated. So and again, just things like taking toes back, putting the correct shoe on, it's not to be ignored, despite the fact that we're probably going to end up doing some form of treatment to these horses. Steroid medication, intra-articular, cortisone, still the foundation of the treatment of most of what we find. It is really a good use of MRIs to check that you can use it, say for example if a horse blocks to the coffin joint. If you've got a deep flexor tendon injury, you perhaps don't want to be medicating that horse. So it can be used to check that it is so-called safe to use a cortisone injection, and it's useful for that. Steroids into the bursa, we shouldn't be afraid of it. It's still a very effective treatment, even in horses with fibrillation of the tendon. We're probably a bit shy of it now because of the MRI, but it certainly is still getting horses sound. We've spoken about biologic agents. They are numerous, and again we go through phases of using different treatments that we think are useful. We don't use Tildren. It's probably a practice thing. I don't really believe in its use, but it can potentially have some effect, and it is used, I know, in other practices around. Surgical procedures, we've spoken about bursoscopy. This is Richard Payne doing a standing condylar fracture repair on a little racehorse that we've detected a condylar crack in. So it can have a really good effect on potentially avoiding disaster in some cases as well. So as far as what the future holds, well, we're scanning an awful lot of horses. Is it really going to continue to increase? Are we scanning the right horses? We're not scanning horses now at the end of stage of pathology, which is very good. But there's a tendency to scan too early, or perhaps before we've had a chance to sort these horses' feet out or look for simple things. And it's a question mark really, because we have to have the insurance companies on board with this, and so we need to make sure that the horses that are going through MRI really do need an MRI. This really is the best way forward. If we lose the insurers, then the scan numbers are going to go down for sure. So we have to make sure that we're treating those appropriately. As I've said, are we scanning the right horses? I think it's that, there are perhaps a cohort out there that are missing out on this, and we need to encourage those in. And what can and what should we do with the information we're generating? So we are generating a huge amount of data. We need to get the chance to look at this, to evaluate it. Practices such as this one, where we do, where you guys do research, and make sure that you feed that back to the cases and to your referring vets. It's very, very important. We don't just image for image's sake. Okay, thank you. Sorry if I've run over just 6 minutes.